Okay, good evening, everyone. If you can get my audio, kindly confirm with a reaction. Thank you so much. I would wish that we begin as our colleagues also join in. I know we had or we're beginning a bit into the meeting. It's about 13 minutes post the start time. However, I want to relay my appreciation for the evening. My name is Dr. Silvanus Manyala. I am the Communications Associate at PSK, and I wish to introduce this session, which is very key to our membership as we anticipate the upcoming 46th Annual Scientific Conference. And this is just part of the pre-conference webinar series that we have been conducting to support the delegates who are coming in, our researchers internally who wish to present at the conference, submit the abstract, and we are pleased to have the abstract reviewers, so the abstract review team with us as well, who will be introduced in a few. But just again to lay context on a few things for your attention is that we are doing, or we are holding the conference this year under the theme Pharmacists Leading Transformation and Innovation Towards the Highest Attainable Standards of Health. And we have 5 focus areas, which translates to the 5 categories we hope and we are looking, of course, we have been receiving abstracts for. Number 1 is pharmacists as pillars of health systems and strengthening, under which we the focus would be around universal health coverage, primary healthcare strengthening, the scope of practice, which is the recipe for patient safety and quality of care. The second category is on the role of pharmacists in policy, regulation, and professional direction. And here the focus areas are around policy, regulation, and professional oversight, nurturing proactive policy engagement by pharmacists, the regulatory compliance and quality systems in pharmacy practice. The third category is around pharmaceutical sector growth, where we will be looking into local manufacturing, market access, and supply chain resilience. And some of the focus areas include closing the skill gap for pharmacists, a bit more on market access, digitization of supply chain and business continuity. And the most important bit is financing investments in local manufacturing and economic development. And the fourth category is on digital health and innovations, where we hope to inspire and, of course, have discussions around digital health, AI, and, of course, the role of pharmacists as digital health influencers. And, of course, number 5, which is now the human side of pharmacy practice, is around focus areas around mental health and well-being, leadership and career growth, as well as ethical pharmacy practice. Now, we have our conference coming up between 24th and 26th June in Mombasa, Pride Inn, Paradise Hotel. And maybe at this point, I wish to maybe now go slow and introduce my co-moderator, Dr. Miles Munro, who will have the opportunity to introduce the abstract reviewers. And then we have a very interactive session where we hope to engage you so that we also support the quality of abstracts that are being submitted. Afterwards, we will share a few updates, especially those that are relevant with regards to abstract submission, including the new timeline adjusted to support and ensure that everybody has the opportunity to submit. And of course, any reminders with regards to the conference. Dr. Munro, if you can hear me, back to you. Or I'm handing over to you. Thank you.
Thank you. Thank you so much, Manala, for the introduction. And thank you all for joining this webinar this evening. Maybe just a few ground rules. Ensure you have subscribed on the PPB portal for this event. It is exactly as it is on this on the poster, pre-conference webinar research methods. And I will be able to share tokens in time. And just so we don't spend so much time, I'll take this moment to allow our panelists to just say to introduce themselves briefly, and then Prof. Calvin can proceed from there. Maybe we can start with Prof. Ermias.
Yes, thank you, Miles. Good evening, colleagues. This is Ermias Sarafa, a pharmacologist from USIU. It's a pleasure to be here this evening. Thank you.
Thank you. Thank you, Ermias. We can proceed to Prof. Nyamu.
Thank you. I am Professor David Nyamu. I'm a clinical pharmacist and a very passionate researcher. And this is a very, very crucial thing that we are discussing today. Karibuni sana team members and colleagues. Thank you.
Thank you. Thank you, Prof. Nyamu. We can proceed to Prof. Calvin. Maybe as you introduce yourself, you may also proceed with the presentation because of time.
Thank you, everyone. Good evening, colleagues. Calvin Andevomolo. I'm an associate professor of pharmaceutics at USIU Africa, and a passionate researcher. And I'm happy to be here so that we can talk a little bit about research, your abstracts which you are trying to submit, and just see if we can have discussion and help each other so that we can, at least we as a team, are expecting you guys to send us some good, exciting proposals so that when we be in our conference in Mombasa, these people can see the work we've done and you can disseminate your results and we can learn, all of us, on great research that has been happening in the country. So thank you so much. So this evening, I'll have a short presentation, just how to write an abstract. So it will be very short, and then I'll just give a sample of an abstract that is well written to see, so that for those of you who are struggling or thinking, how can I write, and thinking it's really difficult to write, it's really easy once you know how to do it, and just maybe avoid a lot of words. Maybe I'll just go straight to the short presentation that I prepared. which is how to write an abstract. So basically, you've seen calls whereby we are requesting our members to submit the research they've been doing for the whole year so that we can look at it, and for those that will be accepted, they will be given a chance to present at the conference. And this is a huge deal as gives you a chance to showcase the kind of research you've been doing, and you educate your fellow professionals on the good work you've been doing. So comes here, why do we want to write? And why bother write well? Well, if you don't write, you can't communicate. And if you don't write well, you won't also communicate well. So it's always important to take that step and try to write. And writing is one of the oldest mode of communication that has always existed. And when words are written, people can read, understand, and you are able to communicate what exactly you are doing. So reasons for writing, and most people, I know we meet a lot of people say they don't want to write. They think, oh, they don't want to write because I don't know where to start. Even you write, so for the you guys who are doing research and all that, but everyone can write. It's not that difficult. It's just you need to start. And you should know, some people don't write well because they don't know how to start. Where do I start from? And then there are those who have anxiety writing skill. They can tell you, I have writer's block and all of this. So those are some of the reasons people can give for not writing. And then we have those who have everything, but they think they're not good enough. We always have that imposter syndrome that we feel we are not good enough to do this. This is just left for big professors like Nyamu who can write. But it's not true. Anyone can write. And if you have any results, any findings, you can find your footing and write. You just have to begin, and it's always good to know where to start. So for any of you who have some data, who have some findings, and they don't know how to write, you can always reach out, and we can always guide to help you begin that step of writing. And once you start writing, you find it's really interesting and makes you express, and you really feel proud about yourselves. So when we're looking at this, we're just looking at what we will do, what types of publications we can give at the conference, how can we write submission, and some writing tips. So we go to our main objective, was what it's an abstract, because you've seen course saying you want your abstracts kindly submit so that we have some research we can showcase at the conference. Basically, an abstract is usually a very concise statement of the major elements of your research project. And in that abstract, you need to state your purpose, your methods, your finding of your research. And also, it's usually just condensed version of your scientific paper. Basically, just give us a snapshot of what you've been doing. And that snapshot, basically now, it's like, for those people who watch movies, like a trailer of what you expect for your research. So for those of you who have done little research or something, just want you write something in 350 words and submit. So we'll go into that. So to write that abstract, first of all, you need to identify your topic. Are you doing experimental research? Are you doing case study? Do you have a case series? Are you doing other modes of research? So it's always good just to do your background of the data you have, and then look at the themes of the conference, and then try to align what you have with that. So it's always important now when you have that, you see, how can I coin a topic from this? So that's usually very important. You identify your topic. And then once you do that, you need to do a background a little bit. So maybe you're working on something on antimicrobial resistance, or you've seen something being done at the hospital stewardship and all that. Just do a background search and see what other things are being done. What are people doing in that area? And how unique can be my findings, or what problem exists that I'm trying to solve. So through that, you can work through various databases like PubMed, Medline, MD Consult. We have Google Scholar, a lot of them that exist, and all of them are available widely on the internet. And if you consult also the education committee of PSK, we can always guide you where to find the information. So when you're writing your abstract, what are the common things? We have the 4 C's of writing an abstract. 1, it must be complete. Tell a story from beginning to the end. So it covers the parts of the project or case. 2, it must be concise. It contains no excess wordiness or unnecessary information. The 3rd C, it must be clear. Should be readable, well organized, and not too jargon laden. When you're writing an abstract, you're just communicating your research in snapshot in a simple language whereby everyone can understand what you're doing. And then cohesive, must flow smoothly in all the parts you have. You have the introduction will be there, and then you have the methods coming in, then you have your results, and then you have your discussion, and then you have a conclusion. So you have a story you are just telling that flows smoothly between all those things. So it's something you can. So when those of you are struggling just to do an abstract, you can look at this and consider these 4 C's for your writing. And then next thing, now you know what you want. An abstract must have a title. So if you have the title of what you're doing, and create a title that's winning, that is catchy, that is appealing, not too wordy, just something that people can attract people to read your research. And then format it well. And then after the title, you need to give now, it's always good now to put all the name of authors, people who have contributed to that work, plus the institutional affiliations. So that's something you should consider and do when now you writing your abstract. And then you need to do an introduction. So an introduction provides just the subject, the purpose, the merit of the research. So for example, you're talking about certain disease, you have just it's a problem, how big it is, and why you're doing this. So you present background information, and it should be comprehensive on the literature review, what's happening, and also collaborate on what you're trying to do. For example, prevalence of mortality, 1,000 people each year die of certain disease. That's why we are doing this, try to prevent ABCD. So that introduction must be really, really concise, but also gives the purpose and the merit. So, sorry, I was just receiving a call. So, to other parts, and then you'll go to now your methods after the introduction. So the method just says what methodology you use to collect the data. So they want to see, are you following the known methodology? Was it, what can I say? It's a known method. Is it has been, so the method clearly describe the way you went about in collecting the data. So, and then after the method, now you, in that abstract, show some results. So those results, you can state what you found out. Out of 100 people interviewed, 3 of them were saying ABCD. Out of the 3 of them, 2 of them found to have is XYZ. So you put those results into there, and then you have your conclusion. What are you concluding? So the results show that the prevalence of disease in Africa is ABCD, especially in children under 5, which shows that more effort should be put in eliminating certain disease. So you see, you are concluding basically what you find out. And for this year's, we requesting for you to get an abstract of 350 words and should have all these sections: the title of the information, introduction, method, results, and conclusions. So before finalizing, always, if you are new to the field, look for a mentor. Just get someone to go through your abstract to see if it's okay. They'll give you some pointers, and then they'll give you feedback. You make those revisions. And then also you can have your peers, because just have a read through your draft in order to check for any technical errors such as misspelling, grammar, mistakes, and all that. So you don't want to be submitting a document that also has a lot of typos. It's not cohesive, not flowing. So when you give somebody else to read, they can always see what you did not see. And then also, and one thing, find a mentor. Always, if you want to go far, you can go you can, if you want to see if you stand on shoulders of giants. So sometimes just find somebody who has done it, who knows what they're doing, and try to make them go through your abstract, and they can give you pointers that you are really didn't see and can make your work more exciting because I've been there and I've done it. So perhaps submission also, we have given some instruction, follow the instructions, include headings exactly stated in the instruction, all the template is there. Use short, clear sentences, one idea per sentence. So limit your abstract to the words and count that's required. Always read, edit, edit, read, edit, edit, read, edit, edit. And then always check your grammar, the syntaxes, situations. Those are something you have to look at for your abstract, because that means just have a good, clean document that when someone reads, they just smile and enjoy the work they've done. So after that, yes, you've done it. You can submit your abstract. Always look for the deadlines. And some of the reasons, I know a lot of people have submitted and we are doing reviews why some of the abstracts may not be accepted. One, you may have poor presentation. People really don't know what you're presenting. Things are jumbled, mumbled all over the place. So that poor presentation might prevent you from exactly trying to communicate what you want to communicate, and the team of reviewers may not understand what you're trying to say. So they may just toss aside your abstract. The discussion also, in abstract, you see the words are limited, but those discussion must be succinct, but also straight to the point and must really speak to the results you have. And then lack of originality, just don't go copy and paste other people's work. When you're doing research, basically you're trying to solve a problem. So it's a waste of time if you try to present something that already been known as a fact. So lack of originality might be one of those. So you need something that's a very novel. Poor methods, if you look at this methodology and you're looking at the results, the doubting probably these methods cannot bring the results, and then you know your work might be rejected, and then inappropriate statistical analysis, and then also you have results that don't make any sense, inadequate results. So those are some of the things that can make your abstract be rejected. So writing is an art. You can learn how to improve. Read other published manuscripts, abstract carefully in journals, and focus on details. Always practice, 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 practice. As you practice, become better. So, and always look for mentors who can help you and colleagues who can read. And then sometimes you think you are poor in writing, you can attend those writing skills and read books. They always tend to improve. The same as you practice, as you write, you improve yourselves. So some of the tips when you are writing this abstract, avoid active voice is usually preferable to passive one. We studied 15 patients with ARDS is much better than 15% with ARDS was studied. Okay, so active voice is very important. Always use the full term before you put in an abbreviation or an acronym, so that not everybody is familiar with your acronym. So always write in full, and then write only one thought per sentence. This is usually a big problem for most writers. You find that you have one sentence and it has 20 or 2 or 3 thoughts, and then someone gets confused. So always stick one thought per sentence. Don't be too wordy, eliminate unnecessary words, and then ensure that verb tenses are consistent and correct. So publications usually are scholarly activities that are very important, that required for career growth, training, and for you to become a better practitioner. So when you do research, you practice what you research, and you learn problems, and you become even a better practitioner, even if you're not in academia. For those in academia, it's very important. So I'll leave you this quote from Faraday, who once said, work, finish, and publish your work. So if you don't publish, people will not know what you've been working on. So thank you for listening to me and this brief presentation about abstract. I hope you have learned something. So I heard something here. It was just a sample abstract. You can look at it. Then I can hand over to the team. So this is sample. I hope you can see my screen. You can see we have a title here. We have all the authors and the affiliation, the background information. Someone has objectives, his methodology, results, and conclusions. And he has some keywords. So if either of you are having problem and you have data, they don't know how to arrange it. These are just a simple abstract how you can arrange it and just pay attention to those nitty-gritties that you have been working on. So thank you, everyone, and I think I'll hand over to Miles and Silvanos to continue.
Yes, thank you so much, Prof. I appreciate and very excited that you, again, just are willing and ready to remind the delegates that the winning abstract is not as complex as maybe some of us might have thought, and that would help us, get motivated to even do the last minute submission. I know we had mentioned earlier on that we have adjusted the timelines, and these timelines would hopefully work for some of us who are yet to submit. Now, at this juncture, I wanted to, of course, just invite Professor Ermias or Professor Nyamu, if you would want to, again, just contribute to the discussion and what you think, maybe your opinions on what now we expect for the next 7 days before we close the deadline for submissions. If there's any input from your side, let me know. And then maybe as we head to hear from, if there's any input from the rest of the reviewers, members, if you'd like to ask a question, please type on the Q&A tab. If you'd like to speak, raise your hand and we will give you the opportunity to engage in the next few seconds. Let me go back to the panelists, Professor Ermias, Professor Nyamu, if you have anything to add on to the presentation so far.
May I go first?
Yes, sure, Prof.
Yeah, thank you so much, Professor Calvin, for the presentation on the outline of the abstract. I hope that I'm audible.
Yes, very much audible.
A few comments on for the members is, number one, you need to know the structure of the abstract, the major components of the abstract. And an abstract should be about a page in length, not 2 pages, just a page. An A4 size, just 1 page. And that abstract should not have any discussion, should not have any literature review. You are not doing another dissertation or another thesis. There should be no discussion, no literature review, and no references. You don't expect references in the abstract. And allow me to talk more about the results section, which I found many people actually missing on the results section. I'm sure the background, the objectives, that one is clear, and the methods, that is straightforward. But on the results, a common mistake that people do is to copy and paste your dissertation or your thesis results. That is not what we do. On the results section, the first opening sentence we'd expect to read is the characteristics of your population. If you're dealing with the patients, what was your characteristic of those patients that you're dealing with? That's the first sentence. Then the second sentence is look at the objective one, which you set out to do. What were the results of that? What were the key results of that objective number one? And then the third sentence is what were the results of maybe objective number 2 or number 3, but focusing on the overall objective. Don't give results which are not adding, which are not tallying with your title. Don't give results which are not tallying with your title. Remember, even that dissertation can even have several abstracts, depending on what you want to communicate. Always, as you write, focus on your main title. Whatever you present, is it in line with the title? And then we'd expect the last sentence of that result section. Maybe you are doing something and you are doing some statistical analysis, and you did some kind of regression analysis. We'd expect to see that. What did you find? What is the main thing that you found out? You are picking the main items. Remember, even if the p-value is less than, is more than 0.05, you can still communicate your results. You can still communicate negative results. Not a must, you have to communicate positive results. Let's say if you wanted to find out whether knowledge impacts on adherence to the medication among the hypertensive patients, and you found that knowledge actually had no association or was not associated with the adherence to the medication, you can still communicate that and you show us actually the p-value was more than 0.05. When it comes to now, after the results, you are doing the conclusion, is pick out what is standing out. Just pick that thing that is standing out. And you pick from the results. Don't pick from your own mind. Don't pick from the literature review. Just pick from the results. Don't go overboard. And ensure that that conclusion is actually spec'd on your main objective. So you set out to do this, and this is what you found out. Now you conclude. You must be your main objective, your overall objective. So don't do conclusions which are overboard, which you don't say. Actually, the common mistake is that people conclude from what they never did. So you go and find out that knowledge among the diabetic patient does not actually is associated with the adherence. And then you won't tell us adherence can be improved by training the doctors on how to communicate. And that is not what you set out to do. Just limit yourself on what you set out to do and conclude from your objectives, from your results. When it comes to the recommendation, now the last bit of the recommendation, we expect something like 1 or 2 sentences. Just recommend from your conclusion and the results. Also, don't go overboard. Don't do, even if it is very enticing, very captivating to comment from outside, don't go beyond what you didn't do. Limit yourself to what you have done, and have one conclusion for the change of practice or change of policy. And then the other conclusion for future or further studies that you need to do. Don't just do an half-assed conclusion. We expect to see the first sentence is now you are recommending on the change of practice. This is what we need to do. This is what we need to do on the policy. And then the other conclusion should be, the other recommendation should be a change, to be further research. And the further research actually is what you never did, but you thought that from this study, you can also generate other studies. And remember that abstract in the dissertation or in any paper is the most read part of the paper. So it must communicate clearly. It must be sensible. It must be logical. So I've mentioned about results, conclusion, and recommendation. Obviously, the first thing that you expect to see in your abstract is the background. And the background basically is the impetus. What drove you into doing this research? What was your driving force? That you, one sentence, maximum 2 sentences. It's not a whole literature review again. 1 or 2 sentences are enough for the background. And it is the impetus of that particular study. From there, you go to the objectives. And in the objective, just quote the overall goal that you set out to do. No need of doing the other specific objectives for the abstract. Pick the main thing that you intended to do, you want to communicate. And then from there, now you go to the methods. Methods we expect to see now part of what you are doing. And then you expect to see also something on the data analysis. And data analysis, you will capture the demographics again, or the descriptives. If there are any associations, you need to capture that, and the chi-square, or they may be features exact that you computed. And then from there, we expect now to see what kind of logistic regression, what kind of regression that you did. And then you finish your abstract. Very simple. At times, I encourage people to actually write the abstract, bit of background, objectives, methodology, without even looking at what they did in their main work. Just write from your own. You can counter check that later. When it comes to the results, you can go and check, because some of the figures is very difficult to remember. You can check the figures. When it comes now to the conclusion and recommendation, you don't have to go and copy and paste from your main book. You can actually write those ones in your own words. Okay, those are the things I wish to emphasize. Well, thank you very much, Monroe and Dr. Manyala, for holding this kind of a seminar or a webinar. We need to have this kind of interaction more, because I know writing is not easy. I've seen even PhD students, master students having problems in even scientific writing. And I know some of our colleagues are interested in writing, a lot in writing. We can have more of this for the people who are interested in doing research and the publishing. Thank you very much, Dr. Manyala. Over to you. Is it Dr. Manyala? Is it Dr. Monroe?
Yes, thank you. Thank you so much, Prof. Yes, I think we appreciate. We might have lost your audio the last 30 seconds, but yeah, I think that is well put. I want to check if Professor Ermias would like to also share a word before we assess if there are any questions directed to you. Thank you.
Thank you, Dr. Manyala, and thank you, Prof. Nyamo. You've really added a lot on excellent presentation by Prof. Calvi. No, mine is just to summarize it. It's just to see it from the positive side, and people should think, what is the benefit of submitting an abstract to my professional career, okay? Especially students of pharmacy students in their final year, young pharmacists, they need to really seriously consider this one, because it is an added value. It may not be a must, but it's not also a bad thing to submit an abstract, to go and have an oral presentation or poster presentation. Allow me to state in a different way that an abstract is just like a love letter. I don't know how many of you have done or written love letter in the past, but when I was a university student, there was no mobile, so we have not used a WhatsApp to share a love letter. And I need to read this love letter, which contains a background, objective, method, and result, and I believe that can give a perspective. My love letter reads in the background saying, is laying the context. So in any abstract, you need to lay the context. And basically why we write an abstract, and as Prof. Nyamu was saying, it is the most part of your research that is being read that will have high visibility. People first read your abstract, so it should communicate to anyone. That is why some journals prefer you write your abstract in plain English. From the moment you came into my life, something quietly changed. I started to see the world a light differently, and I found myself paying attention to the small things that remind me of you. So here you see the guy is putting the context. Then the next paragraph should be your objective, just one sentence showing the purpose. What is the purpose of your work? And you can write it saying, I wanted to understand why I feel this way about you and what makes you so special to me. And you go and write another paragraph, your method, saying like, I spent time with you, listened to you, watched how you treat others, and reflected on how I feel whenever we are together or apart. You see, this could be a method in simple way. And finally, you need to bring in your finding. Maybe saying, I realized that your kindness, your honesty, and the way you make me feel calm and understood how slowly become very important to me. This is a finding. And finally, you need to conclude. You need to share what is the final message at the end of the day. And you can say like, I know now that what I feel is real and meaningful. And I would love to continue growing this connection with you. That is the final message. And finally, you need to put in your keywords, which will capture now the essence of your message. Maybe 5 keywords could be love, could be connection, kindness, maybe growth, connection, and whatsoever. So usually when we do review abstracts, the key parts we need to see are for completeness of these 5 parts. And it may be difficult sometimes to write a solid and everything in your abstract, but it's a summary of whatever you did. And I need to encourage everyone to submit and to participate in oral abstract presentation or in poster presentations. And back to you. I believe that explains most to the audience. Thank you.
Yeah, thank you. Thank you so much, Prof. I hadn't realized you were quite of a poet as well. And I think that's quite a delivery. I've just seen Kangogo Kibet asking what was the p-value odds ratio in your love letter. And maybe that's just to show that, of course, we appreciate, and now we are learning more on what we need to do. There's also a comment from Jacqueline Kipetru that she has always had questions on the importance of submitting an academic abstract, and today she has learned something. So again, this is just to show that we have actually managed to meet one of the objectives, or one of the key objectives, which is now to highlight the importance of participating in submitting abstracts for this conference. I haven't seen much of questions, but I know one that has been raised directed to Professor Calvin's presentation has been answered on the Q&A tab. And I just want to again appreciate members for patience. I'd like to quickly switch and make very brief announcement. I know we had targeted that this session would go until the top of the hour, so that it's again not very overwhelming. So first is to remind us that in as much as we now focus on the abstract submission process, one of the important things to do is register for the conference. We'd like you to come and participate as a delegate, or as an author, come to share your paper. And we are within the regular tickets phase that closes at the end of the month, coinciding with the deadline for submission of the abstract, after which we will swiftly move to the late bird tickets that will run from May 1st until 31st. Now, the good thing with this is that we have about 7 days to still benefit from the lower rates within the regular phase, because once we switch over to the late bird, the rates go up slightly. And we, of course, would want you to take advantage of the lower rates as is at the moment. And the process of registration is quite simple. For members, you can access the registration portal, and under the public events, you would see the PSK 46 PSK Annual Scientific Conference. Click on View and Register. As you can see on the left side of the screen, that is the what you would be able to see, and then you can pick the ticket that is applicable to you. Select delegate ticket. If you're a member, you just need to input your registration number, and then the applicable ticket will pop up. For non-members, again, it's just the same process, but now you will have to select non-member, and the applicable rates will also pop up. It's pretty straightforward. And again, just to reiterate that we are accepting abstracts. The adjusted timelines is that once the deadline reaches at the end of the month, the review team will go through the abstract, and by 11th May, we should be able to have some form of feedback, whether it's an acceptance or rejection, and then guidance afterwards to those who will have been accepted to submit their soft copy posters and presentation by the 22nd of May. And again, reminder to register for the conference. The regular tickets are available at the moment. On May 9th, we have a nature walk at Olulua Nature Trail in Karen, and we invite all of you to participate. The walk is open, and we had limited slots. We are actually doing the last bit. We don't want you to miss out on this. It's only 300 shillings for registration, and we've covered the other logistics costs, including refreshments. So we don't want you to miss out on this. And then, of course, what is happening right now at the Sarit Expo Center is the Med Expo 2026. We have our last day. We welcome you to come and engage with us at our booth, number 164A, and get to learn more about CPD events, get to learn more about the conference and other opportunities that exist for the membership. Again, it's a good platform for you to interact with other stakeholders and partners within the pharma and medical space. And lastly is a campaign that we have been currently running for our membership. This is to all, spanning from the recently registered pharmacists to, again, the legacy members. We want to understand more of what you do, and this again is going to help us map the workforce across all the counties, strengthening our advocacy efforts, as well as just having a database for pharmacists who we can onboard on some of the pilot projects and programs, as well as initiatives that we have in the pipeline. And I want to take this opportunity to again thank all of you for your patience, for making time to participate in this session tonight. Special thanks to the panelists for, again, creating time to share with us on the expectation, guiding us on writing and submitting winning abstracts. We hope that we'll get quality abstracts by the end of the deadline, and looking forward to your participation at the 46th PSK Annual Scientific Conference later on in June in Mombasa. Thank you all, and good night.